So you've mentioned nitric oxide a number of times, obviously highlighting the importance there when it comes to heart disease and prevention. You mentioned the leafy greens and that being part of producing it. You also mentioned the oral microbiome. And I know a piece of that is not using at least conventional mouthwash and killing the microbiome. But let's take it from both ends on nitric oxide, including the piece I just shared. Get into more specifics on what we're doing, killing off things in the oral microbiome and other things we're doing to hinder it. And then we'll move into things we can do to up it.
So things that can affect the nitric oxide pathways, are physical activity. You don't exercise or force any blood across your glycocalyx. So the underlying endothelium is not stimulated to release nitric oxide. But the oral systemic pathway, that requires a healthy oral microbiome. You need nitrate reducing bacteria. There are testing that now are starting to come online that you can test to see, do you have these type of bacteria? But if you don't have nitrate reducing bacteria, you can eat all the green leafy vegetables in the world you want. You're not going to be able to make nitric oxide through that pathway. But where it mostly happens is that people are using antiseptic mouthwashes and they kill all the good bacteria in addition to all the odor containing bacteria. You don't want to be doing this. The other thing that happens is, people are using things with fluoride in it. Fluoride tends to disrupt or change the oral microbiome. So you use fluoride-free products. Definitely don't have drinking water that has fluoride in it. And stomach acid. You need stomach acid to break down proteins. You need stomach acid to make certain enzymes. If you're using proton pump inhibitors or tons of antacids and have low stomach acid, you're not going to make nitric oxide through that pathway. So sometimes it's about removing the damaging things, not necessarily adding things to the regimen.
Okay. A couple highlights there I want to dive deeper into. The proton pump inhibitor, somebody that's been on those affecting stomach acid, if they're going to wean off those with a doctor in a healthy way, does the stomach acid tend to come back naturally?
It may need some support. You might be able to, get by using some apple cider vinegar, and you might have to definitely go through a kind of wean off protocol. You're not going to be able to stop cold turkey. So you have to work with somebody who's done this before.
Okay, and then same thing for the oral microbiome. Somebody that's been using mouthwash killed that bacteria that we need to produce NO. Is there a way to reinoculate that through a probiotic, or is it just about leaving it alone and letting it come back naturally?
There are companies that are working on different like probiotic gums that can help stimulate the right type of bacteria. Also, there's nitric oxide technology products that are oral dissolving lozenges that release nitric oxide, and just having nitric oxide being released in that pattern can help with basically re growing the good bacteria. So just having more sufficient nitric oxide tends to bring the other ones back online.
Is that Dr. Nathan Bryan's product?
Yes, his products do that.
Any other companies?
Calroy makes a lot of the probiotic gums.
Okay, let's talk about other than the leafy greens, other supplements. You mentioned exercise as well, producing NO. But dietary wise, supplement wise, things we can take other than Dr. Bryan's products to enhance that.
And there's companies that sell concentrated beetroot. You got to make sure you're working with a reputable company. But there's a company called Beat It. Their products have the 300 milligrams of nitrates in them. A lot of Olympic athletes use that as their kind of pre-workout, because if you have enough nitric oxide, it helps vasodilate the arteries and you get more blood flow to the muscles. So Beat It, or the older product, super beads, the powder, not the chews, can be beneficial.
Exercise has come up a couple times, once directly to NO production. Somebody right now who has been metabolically unhealthy, they're overweight, they've determined they have plaque, and they're nervous about exercising because of that. But part of the remedy to what they're facing right now is the fact they haven't been exercising and treating their body right. How do you work with somebody in that situation?
So somebody's been inactive for an extended period of time and is not been pushing it, so they don't know if they have exercise-induced symptoms. They should see their doctor and talk to them about what kind of exercise limitations they may be facing. Some patients, depending on risk factors and other things, they may require getting a stress test before going on a supervised exercise program. So you definitely want to make sure that you know that is it safe enough for you to exercise. But if it is, exercise is one of the best drugs at helping release nitric oxide and keeping the blood pressure flowing appropriately.
And somebody like you who's tuned into this, coming back to the leafy green piece, somebody that has the proper bacteria in their mouth to make that conversion and produce NO, is there a certain dosage or frequency with certain greens you like to get to make sure you're keeping that bumped up?
I mean, you need a dose generally of at least 300 milligrams of nitrates for that oral pathway to really work well. And they make the little test strips. They're a good starting point, but they're not always 100% effective, because if you have an oral infection, they're going to be falsely looking good, and that person probably does not have healthy nitric oxide levels. So you have to look at the whole picture. Like, does the person have normal pulse wave velocity? Do they have normal blood pressure? Okay, good. You're not as worried about what's going on in the oral microbiome at that point. But that's the challenge, is that you know trying to get it through dietary means alone sometimes is challenging for people. They're not eating these things on a routine basis. Or if they are and they're trying to be more health conscious, they're eating organic foods. Organic foods are good for certain reasons, but the soil is nitrogen poor because they're not adding fertilizer to the soil. So the nitrogen rich soil has less nitrates available. So it completely depends on where your food's grown. So this is why it's very challenging to say, like, oh, you have to eat 5 pieces of celery a day to get your nitrates. That might be true if you're in Texas, but if you're in New York, you might need 50 sticks of celery. It depends on the soil conditions.
Okay, so I want to go over high level what the different inputs are for NO again. Exercise, the leafy greens, you mentioned beet powder. We talked about the lozenges. Any other big ones I'm missing?
The big one is it's the UVA sun exposure. It's sunlight. Sunlight is the free one. And that's one people usually don't utilize effectively. So midday sun on your skin liberates nitric oxide.
For somebody that's on an animal-based diet, carnivore diet, keto diet, they're not getting very many or any leafy greens. I'm assuming by what you just shared, they can make up for that through sunshine, exercise, other means. How do you feel about those people when it comes to NO versus somebody including the leafies?
I see these patients all the time. And they're often low in their oral nitric oxide pathways. It's expected because they're not putting a lot of, precursors in. But it always depends on what's going on with the arteries. They got stiff arteries, they got high blood pressure. You're probably going to use some type of nitric oxide technology to help them.
So you would say more times than not, somebody on that diet, carnivore or down on the continuum in that realm, is going to need to bump up NO?
Not necessarily. It's that they're going to be low in their oral pathways, but are they doing the other things? Are they getting their sun exposure? Are they exercising? Do they not have inflammation for other reasons? Yes, they might be, quote, metabolically healthy, but they could have high, homocysteine through a methylation process. That has nothing to do with your diet. So if you don't fix their high homocysteine, they're probably going to have low nitric oxide through having high asymmetric dimethylarginine. So it's individualized to the person who's sitting in front of you.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Atherosclerosis is a lifelong disease. It can start in utero, can start before you're born, but you typically don't present to a doctor with symptoms until you're in your 40s, 50s, or 60s. And people can live their entire life, have these plaques, and not know that they're there.